Hi everyone. Today we'll be talking about the quality improvement project that we've completed in association with the Institute of Healthcare Improvement, as well as Bridgepoint Active Healthcare. Our project focuses on the implementation of the electronic patient-oriented discharge summary as a means to improve patient experience. So our interdisciplinary team consists of current and previous students from the University of Toronto with a range of different academic backgrounds. This is just a brief overview of our presentation today. We'll first dive into the background of ePODS, explore both PDSA Cycle 1 and 2 in greater detail, and finish up by highlighting some key accomplishments. So introducing ePODS a bit, to advance patient care and maximize clinical outcomes, Sinai Health System has established a set of quality aims that revolve around safe, timely, effective, and patient and family-centered care. As patients navigate through the complex healthcare system, it is especially critical that emphasis is put on maintaining continuity for patients as they transition from the hospital to the community setting. The Electronic Patient-Oriented Discharge Summary, also called ePODS, is a tool that consolidates patient-specific information in a complete package to improve the overall patient experience. Co-designed with patients, caregivers, and healthcare providers, Bridgepoint developed a version of ePODS that best supports the needs of their hospital and patients based on the 5 sections that was originally established by the Open Lab in 2014. It has since been implemented across various units at Bridgepoint Active Healthcare, including the Acquired Brain Injury Unit, Medical Rehab Units, Orthopedic Units, and Stroke and Neuro Rehab Units. Now, Bridgepoint Active Healthcare is part of the Sinai Health System, and it is a 464-bed rehabilitation and complex continuing care hospital that provides a range of inpatient and outpatient healthcare services. Specifically, our quality improvement project focuses on the implementation of ePODS on 4 North, which is a 32-bed medical rehabilitation unit at Bridgepoint. So at Bridgepoint, ePODS is completed approximately 5 days prior to a patient's discharge by members of the interdisciplinary team, which can include nursing and health disciplines. The team ensures that the information provided is tailored to the patient's conditions and needs and is documented in the patient's health record. With ePODS, patients leaving the hospital consistently receive 5 key sections of information in a patient-friendly report, which includes a comprehensive list of the patient's medications at discharge, education on conditions managed during the hospital stay, as well as daily self-management skills. It also includes instructions on what to do when experiencing specific symptoms and when to seek medical assistance, which is provided. Thirdly, any changes of the patient routine and environmental adjustments are also seen in the ePODS where applicable. It also includes details on upcoming appointments. And lastly, it includes additional resources in the form of health and community support, help from personal care, getting around, help at home, as well as reconnecting with the community is also provided. Now we'll go into some numbers.
Bridgepoint has received positive feedback from patients and healthcare providers following the implementation of ePODS on select units. Scores were collected from the Canadian Patient Experience Survey, or CPES, a survey that is sent to patients post-discharge to evaluate their hospital experience. And based on previous results, Bridgepoint saw an increase in information sharing, so explaining the medications and side effects, and receiving information about their condition and treatment of about 11%, and this is from 44 to 55%. Additionally, there was also a significant increase in discharge transition planning and management, where patients who reported that they had a better understanding of their condition increased by 14% from the previous 40 to 54%, and receiving enough information increased by 12%, going from 42 to 54%. Bridgepoint strives to continue spreading ePODS across the hospital in hopes to enhance patient experience as they navigate through the healthcare system. As such, our team was brought on to assist the implementation of ePODS on the new Medical Rehab Unit 4N. So following a literature review, we kicked off our first PDSA cycle with a presentation that introduced ePODS to the 4N team. We discussed opportunities and challenges that ePODS may introduce, and collaboratively, we agreed on an outline for the process. Additionally, we decided to introduce an enlarged ePODS package, which contained a comprehensive list of medical conditions outlining how patients may feel and what to do. The purpose of the enlarged ePODS is to allow the nurses to educate patients and families prior to discharge, while ensuring that they had enough time to understand information and ask questions as needed. Our team created a laminated two enlarged ePODs that were stored in the charting room until they were needed. And lastly, our team created an ePODS workflow poster that outlined the entire ePODS process, and this was posted in the charting room for staff members to review at their convenience. Lastly, our team created that ePODS poster, which is seen above here, and this consisted of the process that initiated 5 days prior to the patient's discharge date. The ePODS can be started by any member of the interdisciplinary team, who should then notify the rest of the team via email to continue their part. And then 2 days prior to the patient's discharge, the 4N team should ensure that all sections of the ePOD have been completed during the team huddles. And the day before the patient's discharge, the most responsible nurse should then print the completed ePOD package and review its content with the patient and the family. And following our go-live date, our team used a subset of the quantitative questions from the CPES, the Canadian Patient Experience Survey, along with additional qualitative questions to conduct patient and family interviews approximately a week after discharge. And similarly, we met with the staff on 4N bi-weekly to gather any additional feedback. So some of the modifications that we did for PDSA 1 included adding any additional qualitative survey questions around timeline, medication terminology, and an enlarged ePODS as seen here in the picture. And we also adjusted the ePODS workflow process to better meet the needs of the staff. So now we're going to go into PDSA cycle 2. So based on the staff feedback, it was decided that a 6-3-2 timeline would be more effective to implement into their workflow, and this would provide them with more time to implement the ePODS education with consideration to the complexities of clinical workflow. And additionally, staff suggested that they will provide updates for the status of ePODS completion during shift exchange and transfer of accountability to provide helpful reminders for their colleagues and ensure that the steps for ePOD completions don't go missed.
For the first PDSA 1, we contacted a total of 18 patients, and for PDSA cycle 2, we were able to contact 12 patients. Patients were contacted via telephone approximately 1 week after discharge, and up to 5 attempts were made. There were a couple of uncompleted surveys due to a couple of reasons, such as no response to phone calls, number out of service, language barriers, and patients refusing to complete the survey. By the end of the 2 PDSA cycle, our team was only able to collect feedback from a total of 13 patients and 6 family caregivers. This chart shows the quantitative results of the patient survey from PDSA cycles 1 and 2. The subset of survey questions derived from the CPES survey were delivered in the form of a Likert scale and provided our team with some quantitative results. Options on the survey included strongly agree, neither agree or disagree, and strongly disagree. Based on these surveys, our team then utilized top-box methodology to analyze our results. The top-box score is the sum of percentages for the highest points on the satisfaction scale, which in this case were patients or family members who answered strongly agree. Although our results were low in comparison to standard benchmarks, such as the Ontario Rehab average and the NRC average, and findings data from the ePODS implementation on the medical rehab unit, the results are still promising. The results are likely lower due to a smaller sample size of 19 compared to previous surveys, which were based on thousands of data points. In addition, as these were the first 2 PDSA cycles, continuous improvements will also improve results. Further surveys would be required for a more accurate representation of positive impacts of ePODS. Similarly, Discharge shows the quantitative results of the caregiver surveys from PDSA cycles 1 and cycle 2. Based on PDSA cycles 1 and 2, our team also gathered qualitative data to better understand the patient and family's hospital experience, specifically if they did not strongly agree with the statement. Some of the results that stood out include: for the I understood the purpose of my medications, where one patient responded, I don't know the purpose of the meds, too many meds, we just follow the listed package from the pharmacy. Or second example, I had a good understanding of who to call with questions, where any of the patient responded, not really, I was not sure about information, I was quite distressed last night, and I didn't know if I could return to Bridgepoint or find anyone for help.
After both PDSA cycles, our team was able to collect data from a larger sample size of the population, totaling 19 patients and caregivers to date. Based on the results of our top box methodology, we identified the same pain points, had clear understanding of changes to patients' routine, which scored 54% in patients and 60% in caregivers, and having a good understanding of who to call with questions, which scored 64% in patients and 67% in caregivers. From both the highlighted qualitative and quantitative results, we have identified key themes that will help direct the project for PDSA Cycle 3 and beyond. These include dedicating sufficient time to thoroughly review all components of ePODS with patients and caregivers, specifically sections 3 and 5, highlighting healthcare provider contact information, including who to contact with questions and concerns post-discharge, and providing reassurance that information in ePODS is a resource and tool for patients for their transition from hospital to their home and community. One specific recommendation that we had for PDSA Cycle 3 was for nursing and health disciplines to reinforce and elaborate on resources that are available to the patient and family following discharge if any further questions or concerns should arise. This would ensure that patients and families continue to feel supported and empowered to manage their health care. Another suggestion is to address the terminology used to discuss changes to the patient's routine pre- and post-hospitalization, realizing that each patient will have their own unique routine and definition of what is normal. Some next steps for ePODS at Bridgepoint Active Healthcare are as follows. As ePODS has only recently been implemented on 4 North, the quality improvement teach ought to continue with ePODS implementation with 100% of the patients that are being discharged from 4 North. Similarly, it is necessary to continue collecting feedback from patients, family members, and staff to continue QI iterations. Additionally, Bridgepoint should continue to expand ePODS across the various units in the hospital. Lastly, ePODS should be provided in multiple languages to accommodate patient diversity. The hospital has a grant from the Canadian Foundation for Healthcare Improvement to co-design ePODS with patients and families whose primary language is not English. The first population that Bridgepoint will be working with is patients and families who speak Cantonese and Mandarin, which is approximately 5% of our patient population. This work is well underway. Some strengths of our quality improvement project include that our implementation was received by 100% of patients discharged from 4N. In addition, we had quite a timely follow-up, with each patient being contacted within 1 week of discharge. Limitations of the project include that we did not collect baseline data from patients discharged specifically from 4N prior to the ePODS implementation, and in addition, our student project was suspended due to the COVID-19 pandemic. This was a positive quote provided by the family member of a patient that summarized their overall hospital experience. It reads, "I think that everything went very well. It was perfect. We don't believe that anything could have been done differently. Not one bad experience, and my mom was actually very sad to be leaving the hospital. We want to thank everyone on the team for their hard work and making this transition easy for us." Thank you for listening to our presentation. We would like to give a special thank you to our project champion, Agnes Tong at Bridgepoint Active Healthcare, for all of her support throughout the project.